COVID-19. And what we're seeing overall is that people aren't just sick with COVID, they're in the hospital for other reasons. Hospitals normally get challenged around this time of year and get more full at this time of year. So we're seeing that they are starting to get strained in their capacity. We've talked about that strain being felt particularly in the Triad area. I think the hospitals and our frontline workers are doing an incredible job managing that strain right now, but that's why we have to act right now to lower the spread of this virus so that we don't further put strain on our hospitals. And what I would say about our hospital metric, it lags behind others. And what that means is that we will see our cases go up first before our hospitalizations really pick up. And so we may be seeing more hospitalization increase because we are seeing these record high case rates across North Carolina. So we do have, unfortunately, a lot of reasons to be concerned as we head into this holiday season. That's why we focused today on the safety tips, on how folks can gather as safely as possible. I do want to reiterate that the CDC did put out new guidance yesterday to say, please cancel all of your travel. So ideally, we would all be having Thanksgiving just with the folks we live in it with our home. We know that that is hard, and so we want to also provide you with those extra safety tips that you can be doing going into this holiday season. Thanks, Vanessa.
Our next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. First, thank you, Chef, for that chutney recipe there. I appreciate that. But Dr. Cohen, thank you for taking the time. And in typical Brian Anderson fashion here, I have 3 questions for you related to the slow COVID NC app. And I've spoken to some app users who tell me they're concerned about the state not doing enough to promote it, specifically through TV ads or digital social media ads. And they worry that the app's not holding as much value because less than 4% of residents have installed it. So what's the state's plan to get the word out and about the app going forward? Why should people download this app when few people are using it? And what percentage of downloads to date have come from NC residents? Thank you.
Brian, thanks for those questions. We definitely, I'm wearing my face covering today. I don't know if the cameras can see, is promoting slow COVID right here on my mask. So I'm hoping that's one thing. And so anyone who is listening right now, I hope you take out your phone, go to the App Store, Google or Apple App Store. It is free. It takes 5 seconds. It's like 2 taps. To download the app. It doesn't ask for any personal information, and it sits on your phone and uses Bluetooth technology to let you know if you've been in close contact with someone that may have, if they become positive COVID, they can let you know. And so we are doing a lot more to promote slow COVID NC, actually particularly around the holidays, because we know folks are traveling and they may be coming into North Carolina for the first time. And so we are actually putting slow COVID NC signs across the state at travel rest stops. We're putting it at a lot of our partnership sites with our Department of Transportation. So we are trying to get the message out there. Stay tuned for some text messages that may be coming to your phone very soon about slow COVID NC in particular. So we are really making a push around Thanksgiving to promote slow COVID. So Brian, well-timed question, because we're really ramping that up. And some of this is, like, we are asking folks to do a lot in this moment, right? COVID has been a lot of changes for folks, and we're asking folks to take a lot of actions. We're asking you to wear a mask. We're asking you to be 6 feet apart. We're asking you to carry around hand sanitizer and wash your hands all the time. So there's a lot of things that we're asking folks to do. And this is one more important thing that we need folks to do, which is download this app. It does work better the more people who are using it. And so do stay tuned for more coming from us in order to step up seeing more people utilize that. As far as how do we know who's downloaded and are they North Carolina residents or not, because we don't collect personal information, we don't necessarily know if they're in North Carolina or not, if they're North Carolina residents or not. And in fact, I'm encouraging anyone who may be traveling into our state because of Thanksgiving to still download that to their phone, even if they're only here for a short period of time. Keep it on your phone for a number of weeks after you leave North Carolina, because you may have been in contact with someone. So again, I think it's a really important tool, and I'll show my mask again. Slow COVID NC. Go and download it now. Thanks, Brian.
We have a follow-up from Brian Anderson.
Hi, thanks. And I'm just curious, are any hospitals in North Carolina overrun and unable to have enough hospital beds for patients infected with the coronavirus?
Brian, thanks for that question. We have had a couple of our smaller hospitals that have seen stretch in their capacity. They've been temporary though, so we've been able to work together in partnership that when one of those hospitals is starting to feel strained, that we're either able to move patients around or surge some support to those hospitals. So all hospitals have been able to stay above water, if you will, because of the good work going on to collaborate and help each other out. It's hospitals helping hospitals in order to make sure that no one hospital gets overwhelmed. But what we're already seeing is that some hospitals are needing to do things like reduce some of their more elective procedures or surgeries in order to make room for all the patients that they had. And that is entirely appropriate, and we appreciate that they're doing that because we all need to manage the capacity that we have in our system. And I will say beds are important, but I just talked with many of our hospital leaders across the state. We know it is our people resources that is really important to manage. We need our doctors and our nurses to make sure that we can have our bed, not just a bed available, but we need to have it staffed by high quality folks. And so that is the thing that we are working on as a team, a North Carolina team across hospital systems and across the state.
Next question is from Rose Hoban with North Carolina Health News.
Hi, Dr. Cohen. It's Rose Hoban from NC Health News. Thanks for taking our question. So, we're seeing the positivity rate go up, and we're seeing the number of cases go up. And, we're at a place now where when the positivity rate was like this before, during the summer, we were in a more closed down state. So some folks have been asking me, like, why hasn't this happened now? So why aren't you dialing things back?
Rose, great question, because we are concerned about our trends going in the wrong direction, and the governor and I continue to evaluate those trends, and we may need to take additional action. No one wants to go backwards, and I think that there are things that we can do right now to try to prevent that from happening, but we are going in the wrong direction, and additional state action may be necessary, and we continue to look at all of those options.
Next question is from Sharon Van Zwieten with Spectrum News.
Hi, Dr. Cohen. Thank you for taking my question. At the risk of being a little morbid, has there been any outreach to hospitals, county morgues, and funeral homes? Because if the numbers of cases have gone up to 3,000 and 4,000 a day and hospitals lag behind those cases, you can imagine in a week or two there's going to be something very bad going on.
Sharon, thanks for that question. And we have worked very hard since the beginning of this pandemic to put surge plans and these kinds of contingency plans into place so that when we are seeing numbers like this, we are making sure that we have visibility on what is happening. I think we are very focused on slowing the spread of the virus to begin with so that we don't get to that dangerous place. I want to give a bit of good news, which is I think that our scientific community, our clinical community has done a great job at figuring out how to help folks recover from COVID. While we are still seeing folks go to the hospital, we have new medications that we can use for them. We've learned a lot more about how to support someone through COVID. And so we actually, while we are seeing some of our highest use of ICU that we've seen in the pandemic, it's still less than we would have expected when maybe back in the early part of this pandemic when we didn't know as much about how to best treat patients. So I think our medical community is doing a great job at helping people try to recover, but it is still an extensive effort to make sure that folks can recover from this if they do need hospitalization. So we don't want to even get into that place, which is, again, why today's message, let's all work hard together through the holidays. Let's slow the spread of the virus. Please don't make your friends or family sick. You could have COVID and not know it. We don't want to be spreading this virus. And again, because we have limited resources on the hospital capacity side, limited resources on the amount of monoclonal antibodies and other kinds of medicines, and we know hope is on the way with a vaccine coming down the road. So let's all work hard together right now to protect each other. Thanks, Sharon.
We have a follow-up from Sharon Van Zwieten, Spectrum News.
Thank you for the opportunity to ask a follow-up question. And this is really more for the chefs, but you may have something to say as well, Dr. Cohen. Obviously, we want people who are cooking to be gloved and masked, but has there been any evidence so far of transmission of the coronavirus through food?
And then I'll turn it over to our chefs to reiterate some of the tips. What we see is the vast majority of spread is through particles that come out of your nose and your mouth, through respiratory droplets. So that is the most common way in the way in which this virus spreads, which is why we talk so much about masks. So masks are certainly the most important thing you need to be doing when you think about Thanksgiving next week. However, particles come out of your mouth or nose, and then they can land on surfaces. So there has been some amount of what's called fomite or surface transmission of the virus. It's much lower than air transmission or the respiratory droplet transmission. And again, wearing a mask continues to prevent those respiratory droplets from landing on the surfaces in the first place. I think the additional tips that we're doing are just to be safe, to reduce further risk. The most important tip, the most important tool is to wear this mask. Second is to be socially distant. And then I'm going to turn it back over to our chefs to remind us on some of the other ways in which I know they are working within their restaurant to go even further to be safe. But don't want to forget masks, social distance, wash your hands. Always going to be the most important, and then these other tips. So who wants to, Jason or Chidi? All right, Jason's going to jump in.
So in our restaurants, the key is definitely, just to reiterate what Dr. Cohen said, is we wear our masks. Anytime there's any food preparation, we're in the building, we're wearing our masks. Another additional thing that is very important to us is keeping our doors open. Be prepared to be a little cooler than you normally would be. Layer up when you come out. We're going to keep fresh air moving. We have a hood system in the back of every commercial kitchen that's pulling air out. Fresh air is coming in. So constant air movement, knowing it's going to be a little chillier, layering up is key. And then we've always been big on hand washings in restaurants. Wash your hands for 60 seconds with hot water and soap. I can't reiterate this enough. It's key to slow the spread of the virus and to keep people safe.
One thing you might notice is our menus are a little bit smaller, and that is because we are trying to keep our kitchens from being as crowded as they normally are. So we are, first of all, make sure that we temperature check everybody on staff. Nobody handles any food or plateware without gloves on, and that includes our servers as well as our cooks. We make sure that we sanitize all of our surfaces regularly, every 15 to 20 minutes with a bleach solution, which is something I would recommend everybody does. And as much as I hate it, we're using disposable plates right now, and everything that's plated is on a banana leaf in our restaurant. We're only seating outside, and the banana leaf keeps it from particles entering our kitchen after somebody's eaten off of a plate. We can just dump that compostable leaf into the trash, and the person who's handling the dirty dishes doesn't have to handle utensils or plates, and anything that food has been plated on is easily washed without the actual surface being, without them being exposed to that surface.
Terrific tips. Go ahead.
Our next question is from Andrea Forcada with K Pasta Media.
Hi, thank you so much for taking my question. Dr. Cohen, I wanted to ask you about testing, and if you know how many Latino Hispanic people are getting the test done nowadays in North Carolina? Thank you.
Andrea, thanks for that question. We have focused a lot of our testing efforts to make sure that we are reaching our historically marginalized communities, our Latinx community, our African American community, and we have really surged testing. We continued, though, to see lower rates of testing in our Latinx Hispanic communities, and that's why I know we've worked very closely with many of the Spanish language media outlets and others to get out the word about free testing being available in their communities without, no one needs to show documentation at those testing sites. So we really do want folks to take advantage. It's free, and they're all over North Carolina with 120 free sites in the next few days. So we hope folks will take advantage of that and get tested.
We have a follow-up from Andrea Forcada with KPASA.
Thank you, Dr. Cohen. Yeah, and is there any data available, like how many people are getting the test done? Like, do we have any data? Thank you.
Sorry, Andrea, I didn't answer that the first time. So we know the percentage of positive tests that come back that are from our Hispanic and Latinx community. We don't necessarily know everyone who's gotten those negative tests. So we don't know the whole universe of everyone that has gotten those tests. We do know what percentage of those who are getting tested are positive by their race, ethnicity, gender, and age. But the universe, there's a lot more folks who are getting tested who are negative, where we don't capture that information in the same way. So I don't have a precise answer, but we do have a lot of data on our website right now. You can go to our dashboard. We actually just updated it even further to see, so it shows some nice trends in how testing is going in terms of cases and other things by race, ethnicity, age, and gender. But we, like I said, we don't capture that for the totality of all those negative tests, so it's hard for us to say specifically. We do capture that data for our state-funded testing sites, and because we are really trying to, as I mentioned, target it to our historically marginalized communities. So we do make sure to understand that, to make sure we are actually targeting the communities that we intend to serve. And that is where we were saying we're seeing slightly lower rates of testing from our Latinx Hispanic communities. And we are trying to do all we can to make sure we're communicating about the availability of testing, to work with trusted partners, to work with the faith community, to make sure that folks know that testing is available.
Our next question is from Laura Lee with Carolina Public Press.
Thank you, Dr. Cohen, for taking my question. It's Laura Lee from Carolina Public Press. I wanted to ask you about the hospitals in the Triad, because you've referenced that several times. And in looking at the data on the dashboard, you can see some of the metrics that relate to the difficulties that those hospitals are having. But in the county data that you all released in the map this week, we only see 2 hospitals who are receiving the sort of most critical marks, and neither of those are in the Triad. So I'm just wondering if you could explain, why the metrics appear on the dashboard to show difficulties, and you referenced the difficulties in the Triad, and yet we're not seeing that in the composite score for the hospitals.
No, Laura, it's a terrific question, and we actually are looking at that closely with our Triad hospitals, and we are going to be making a slight adjustment in the way that we are calculating the composite score. Some of our Triad hospitals are cohorting their patients, meaning they're putting all of their COVID patients in one hospital, and the way that our composite score was working didn't really reflect that in the most accurate way. So once we're able to adjust to the fact that they are having their patients, like I said, cohorted in one hospital, it does actually reflect more strain on their hospital. And I would say, in addition, remember that data was from a week ago. And a lot has happened in a week. So what we are seeing, unfortunately, is that it has accelerated over the course of the week, even though that data was pulled from early, just a week ago. And so we actually have been looking at being able to re-release that data, because things are accelerating so quickly and changing so quickly. We don't want folks particularly the Triad, to think that we aren't concerned about that. I have been hearing with our county alert system, which I think is very good, I've been hearing folks in yellow counties saying, oh, whew, I'm in the yellow county. No. Right, yellow is still a state of concern for us. We have viral spread across our state. I am concerned in all parts of our state. There are certain counties that are even more concerning, and we are trying to highlight that with this color system, red, orange, and yellow. But like we're saying, one, things are changing quickly, and two, the concern is really everywhere. But specific to the Triad, we are going to make a tweak to the way we're calculating the composite score because of the way they're handling the movement of their patients. Thanks, Laura.
We have a follow-up from Laura Lee, Carolina Public Press.
Yeah, I just wanted to follow up in reference to this particular conversation about restaurants. And, we're hearing that the numbers are exploding and that people really need to stay home at Thanksgiving and take particular precautions, sort of limiting leaving their homes. And simultaneously, we're talking about restaurant safety. And, obviously we want safe protocols at restaurants, but are you concerned about inconsistency of messaging about safety if we're saying, patrons can go out and frequent restaurants and at the same time encouraging people to stay home?
Well, a couple of things. One, I think these are tips that we hope that folks do use in their home for Thanksgiving. And I think these are folks that use them every day and have been working hard doing a training. And I think bringing tips to those of us who are going to be hosting others for Thanksgiving. I want to go back to say, though, like the CDC said, and I think you're exactly right, Laura, in saying that we hope that as many folks can celebrate Thanksgiving with just their household members this year. I think that is the safest way to do it. However, we realize that that is a big departure for many people from their holiday traditions. We know folks are going to travel. We know folks are going to gather. And so if they are, we want them to be armed with all of the safety tips they possibly can. So best would be if you can change your plans and not be with other households, and if you're going to get together, keep it small, keep it outside, masks all the time, and consider getting a test. I think that's the message. I'll say, let me just share personally about my Thanksgiving plans. I had planned to travel out of state with my family. I have celebrated Thanksgiving with my family every single year of my life. This will be the first one where I am not joining them for Thanksgiving, and it's awful, right? No one wants to break those family traditions, but we just have to. This is a different year, and there is light at the end of this tunnel. I know I'm going to be getting together with my family soon. We know that vaccine is coming, so we want folks to stay safe. If you can, change your plans. If you don't, please heed the safety tips that our wonderful chefs have been using in their restaurants. Take them and use them in your home as well.
Our final question today is from Sophie Kasakov with the News and Observer.
Hi, Dr. Cohen. This is Sophie Kasakov from the News and Observer. Thanks for taking my question. I have a question about contact tracing. I'm wondering, with people coming in from out of state for the holidays, if contact tracing is still viable in that situation. Are people realistically able to say where they've been and who they may have been infected by? Or wondering also if health departments are turning to the Tracing Collaborative for help, and if there are any lessons that you could share from spikes in cases in the Midwest as far as the usefulness of contact tracing.
Sophie, thanks for the questions related to contact tracing. First, I want to go back to Slow COVID NC, which I also have on my mask here, that everyone should be downloading Slow COVID NC, particularly if there are visitors to our state, even if they're here for a shorter period of time. I think that's an important tool. That's why you're going to see more communications about Slow COVID over the next number of days and leading into Thanksgiving. I think that helps us from a contact tracing perspective as we go forward. Certainly when we are seeing 4,000 new cases a day here in North Carolina, that is a lot of cases to chase down and ask about contacts. So there's a couple things. One, make sure you are picking up the phone to work with our local health departments. Contact Contact tracing still gives us important information about where this virus is spreading and who may have been exposed. So we want to keep that up and do that work. So we again, but I think a really important tool for this is going to be Slow COVID NC and downloading that app.
Our final question is a follow-up from Sophie Kessico.
Thank you for taking my follow-up. I wanted to ask, we're seeing some states and cities closing restaurant dining rooms for the second time, and I'm wondering if North Carolina were to roll back dining rules like capacity limits or an earlier alcohol cutoff, what that would look like, and what a second shutdown would do to the state's restaurant industry.
Yeah, as we've been talking about, our metrics are going in the wrong direction, and there may be the need to do additional state action. And look, places like restaurants and others where you take off your mask to eat, they are high-risk environments. We know that being indoors when you take off a mask is when this virus spreads. So if we need to take additional action at the state, we will. I know the governor's continuing to evaluate all of those options, and we'll look at our trends, as we always do, over a period of time and take additional actions if needed. So we'll continue to evaluate those. But I think we want to make sure you are hearing about the safety tips for Thanksgiving that you can bring to your own home. I want to thank Chef Chidi and Chef Jason for joining me today, for sharing these important messages. And happy Thanksgiving to all. Remember, my 4 tips: keep it small, keep it outside, wear your mask all the time, and consider getting a test. Happy Thanksgiving.